Welcome to your teaching video for your upcoming facial rejuvenation procedures. This is going to focus mostly on facelift, but we're also going to cover eyelid surgery and laser. So based on what procedures you've included, some of these things may or may not be important to you. Remember before your surgery, if you required any medical clearance, either from your primary care cardiologist or ophthalmologist, make sure that is completed before your pre-op appointment. If you're a smoker or use any nicotine products, we recommend you stopping these 6 weeks prior to surgery. You may have needed to get some lab work or EKG, so get this planned and so that you have results back by your pre-op appointment. Read through all of your paperwork and be sure to watch all of the appropriate teaching videos for your upcoming surgery. 2 weeks prior to your surgery, we ask that you stop all blood thinner medications and herbal supplements. Common over-the-counter blood thinners include aspirin, ibuprofen, fish oils, and vitamin E. It's also smart to reduce your alcohol intake 2 weeks prior and after surgery because alcohol is cleared through your liver and you need your liver paying attention to healing from surgery, not clearing all that alcohol. So please do not have more than 1 drink a day leading up to surgery, and if possible, maybe even stop it altogether for those 2 weeks. Don't save your caretaker and rides for the last minute either. If you are staying overnight in the hospital and you're having a big facial rejuvenation surgery that also includes laser, it's not a terrible idea for you to ask a loved one to stay with you that first night. We refer to this as the emotional support human. You will have nurses taking care of you, but they do have lots of other patients, and sometimes you just need someone there by your bedside to help you with the easy stuff like getting something to drink or cold compresses. If you're having outpatient surgery, remember it's a requirement that you have someone stay with you that first night, and if you are having a bigger surgery like a facelift, it may be a couple of days that you need some help. Also, take this opportunity to create a bunch of specific questions that you have that weren't covered in the teaching material already supplied. Remember that we have a separate teaching video that goes over all of your prescription medications in depth. So be sure you watch that one after your pre-op appointment and before surgery. That's also another important one to share with your caregivers. It will go over all of the over-the-counter medications you need and the prescriptions that will transmit to your pharmacy the night of your pre-op appointment. That will likely include Celebrex, which is an anti-inflammatory for pain, Valium, which reduces anxiety and also relaxes your muscles, oxycodone, which is a narcotic pain reliever if you're having more moderate to severe pain, and Zofran, which is a prescription for anti-nausea. If you're also having a laser, we will prescribe Valtrex, which is an antiviral to reduce cold sores that you'll start prior to your procedure. The night before surgery, you can start your Arnica Forte, which is the homeopathic medication to decrease bruising and swelling. If you're having a laser, you can also start your Valtrex. And if you have a history of cold sores, you can start this 2 or 3 nights prior to your surgery. Know your arrival time and place, review your instructions, and be sure your caretaker has as well. And you may get a phone call the night before surgery from anesthesia and also myself. It's also important for you to understand your NPO orders. And what that means is when is the last time it's safe for you to eat or drink prior to your surgery. For food and full liquids, it's a full 8 hours before surgery. So we recommend just stopping at midnight. Clear liquids, which includes water, Gatorade, apple juice, tea, black coffee, and Jell-O, can be continued until 4 hours prior to your surgery. It is helpful for your body to get some carbohydrates in and caffeine if it's used to it, so that you can wake up feeling better after your anesthetic. The morning of surgery, take a fantastic shower, washing your hair with either antibacterial soap like Dial or the Hibiclens soap that we provided at your pre-op appointment. Make sure you don't get the Hibiclens in your eyes, mouth, or ear canals. You can use your conditioner after washing your hair, but don't waste your time trying to style your hair. If it's long enough to put in a ponytail, put it in a ponytail and bring a couple of extra ponytail holders you don't mind losing or getting gross after surgery. Wear easy clothes like a hoodie that zips up in the front. Don't wear any makeup or moisturizer. Bring your Arnica Forte with you to the hospital, but don't bring the prescriptions that we provided. In general, you skip all of your regular medications the morning of surgery. The only exceptions are beta blockers or calcium channel blockers that you might be taking for hypertension. So we will cover this with patients who do need to take any of their normal medications at your pre-op appointment. Not everyone needs to stay overnight following facial rejuvenation surgery. If you're not having a facelift, you should go home. If you are a healthy patient with well-controlled blood pressure, you're not someone prone to anxiety, you have an educated caretaker, you don't live too far from the hospital, and you have some familiarity with the surgical experience, you may be more comfortable at home. It may make more sense for some patients to stay overnight following their surgery. If you don't have experience with having surgery before, have blood pressure problems, are worried about anxiety after surgery, or concerns about pain control, it's much smarter for you to stay. Also, if you're having multiple surgeries, like a facelift with a laser, there's a lot of bells and whistles with this, and it may make more sense for you to stay until you're more awake the following day. I would highly recommend you have an emotional support human come be with you while you're in your room after surgery. You will have nurses taking care of you, but they're not going to be by your bedside all the time. They have lots of patients to take care of. So if you have someone that's there that can just provide support, help you with getting things to drink, and with cold compresses, that can be worth its weight in gold. Also, if you stay overnight, it's likely I will remove your surgical drains the next morning. This video will cover instructions for face and neck lift, blepharoplasty, brow lift, and fat transfer. If you're having a laser, you absolutely need to watch the separate video called Ablative Laser Care, because we won't be covering those instructions here. Following your face and neck lift, positioning is very important. This picture is a little over-exaggerated, but you want your chin to be slightly up, greater than 90 degrees. It's important to have a soft cervical pillow or a roll under your neck. Another way to achieve this is to use 2 pillows under your shoulders and 1 pillow under your head. We just don't want that chin dropping down towards your breastbone. It's important to also be very aware of activities. We need no straining, no lifting greater than a milk carton. It's great to keep your head elevated above the level of your heart, and when you're turning, turn at your waist and not at your neck. We like to keep your blood pressure well controlled with a systolic or the upper number at 160 or less while you're healing to help reduce the risk of bleeding. You'll also apply antibiotic ointment in front and behind your ears and also under your chin 3 times a day. Cold compresses can help with swelling and pain. I prefer patients use wet washcloths in ice water that they place on their neck or over their eyes and rotate them. This way, nothing can be too cold, which can damage the underlying skin. Your diet's also important. You don't want things you have to chew a lot because you will be sore. It's also good to avoid super salty, super sour, and super spicy foods, as these can lead to more swelling and healing complications. You'll also wake up with a device that's draped around your lower face called a soft pulse, and this also helps to decrease pain and swelling. The soft pulse creates an electromagnetic wave, and you won't feel it or hear anything, but it does decrease fluid shifts across cell membranes, which reduces pain and swelling. You'll wear this until the battery dies, which is about 1 to 2 weeks, and you only need to take it off when you're going to be in the shower. If you're having eyelid surgery or a laser, it's also important to pick up a few things to help rinse and lubricate your eyes. Saline eye drops are used to help rinse the eyes, and Refresh bullets are great for this. Also, eye lubricants come in two different formulations. You can get a gel, which is called Genteel, or petroleum-based, which is kind of like a soft, soothing Vaseline for your eyes. Now, the brands don't really matter, but it's nice to have a couple of these available so that you can use whatever you prefer after surgery. We'll also use some prescription eye ointments, but I'll give you these after your surgery. Again, it's super important that you don't let your eyeballs dry out, and because of the swelling and some of the numbing medicine that we give, you may not be able to shut them all the way right after surgery. You can also use cold compresses to help with pain and swelling. Use the saline drops to rinse your eyes as needed. If you're having your upper lids done, we'll give you an ophthalmic ointment that you can put a tiny bit on your stitches 3 times a day. And if you're having your lower eyelids done, we'll give you an ointment that has a steroid in it called dexamethasone that you can put in your eyes every night before you go to bed. If you are having a type of procedure with a lower eyelid incision, it's also fine to put this on your incisions 3 times a day. It's important for people who are having eyelid surgery not to wear their contacts for about 2 weeks. There are a variety of techniques that may be used for a brow lift. You likely will have a scalp incision. It could be 2 incisions up behind the hairline at your temple that are a little bit raised and feel kind of weird, and these are closed with sutures, and you don't have to do anything for these. You might have an incision that follows the front of your hairline, and if you have this one, you'll be applying antibiotic ointment 3 times a day. You also may have some staples back behind your hairline, and again, you don't need to do anything for this. Your technique might also involve an upper eyelid incision, and if that's the case, we'll give you a small tube of ophthalmic ointment so you can put it on those sutures 3 times a day. Just like eyelid surgery, it's important that you don't let your eyeballs dry out. Fat transfer is an easy one. You'll have a small piece of hypoallergenic tape over the donor site that we make, and you should expect some pretty significant bruising from where we harvest the fat. It usually looks a lot worse than it feels. Because of these small incisions, we don't want you soaking in a bathtub for at least a week after your surgery. If you're having a facelift, brow lift, eyelid incisions, or fat transfer, it's safe for you to take a shower the following day. We do recommend washing your hair with baby shampoo. If you've also had a laser, it's likely you will have a mask on your face that we need to leave intact for at least 3 to 4 days. So be sure to watch your laser instructions because you won't want to get this mask in the shower. Now let's talk about what's normal and what to expect while you're healing from this surgery. There will be some discomfort, but most of the bad pain is really the first night after surgery. People describe a tight feeling in their neck, some aching in their jaw, and pain behind their ears where the drains come out. This is usually very tolerable, but as the days go by, what's tolerated during the day may require a pain pill to help you sleep at night. You should also expect bruising, swelling, and puffiness. This is all very common after surgery. You should have some blurry vision if you had eyelid surgery or laser, and people are very aware of some mild asymmetry that they'll notice in their face. Their ears also are quite numb and feel like they belong to somebody else. When you animate, your muscles might be moving a little bit cattywampus or a little lopsided early after surgery. Here are the things that concern us. A hematoma is what we're really trying to avoid. And again, the risk of that happening is most likely going to be in the first 24 hours. But I did have a patient who got a hematoma 8 days after surgery who wasn't really following their instructions. So a hematoma is when an artery bursts open. And so the blood fills up very quickly in the surgical site and it's under pressure. So the swelling is very quick, and it may start either in the cheek or in the neck area and can rapidly spread to other areas, like maybe across to the other side. And because this pressure builds up, the area is very firm and it can look very, very bruised very quickly. So a hematoma is a surgical emergency. I need to see you right away. If it's something small, I may be able to take care of it in the office, or it may need to go back to the operating room. But this can be dangerous because it on your trachea or make it feel more difficult to breathe. So if this happens, you need to call me right away. It's not normal for somebody to develop a rash on their body after surgery like this. Now, you can get some itching from your narcotics, and narcotics can cause a rash, but what we really worry about is if you're having an allergic reaction to a different medication. So if you develop a full body rash or it's starting to spread, you want to stop all of your medications and talk to us. We would also want you to start those antihistamines like the Zyrtec or Claritin and Benadryl as soon as possible. Chest pain, shortness of breath, or persistent pain in one of your legs could be a sign of a blood clot, and that is also something that we would be very concerned about. It might be normal to have a temperature of around 99 or 100, but if it's creeping up to 101, give us a call so we can run through some questions and make sure that this is not an infection. Now, these are not emergencies, but something that you should let us know about during business hours. A seroma is a little bit of that fluid that was coming out of the drains that accumulates typically in the lowest area of your neck. When you touch it, it sort of has a little jiggly fluid wave to it. And typically when I've seen these, they're about the size of maybe the width of your finger, kind of running along the bottom part of the neck. Your body may just go ahead and resorb this, but it's easy for us to put a tiny needle in there and suck that fluid out. So if you see a seroma, just let us know during the next business day and we will get you in. If your blood pressure is still consistently bouncing around and running higher, it's not an emergency if it's around 170, but if it's over 200, you definitely should talk to your primary care as well as us. But if it's bouncing around, we may want to change some medications and involve your primary care. So let us know if you're walking around with really high blood pressure. Your primary care doesn't want that either. Your first follow-up appointment will be scheduled 4 to 5 days after surgery. If you want to be besties with your nurse, take a shower right before you come in and don't put any ointment on the blue sutures in front of your ear or under your chin, because then they'll be easier to see when they take these stitches out. At this appointment, we'll be able to discuss activities, talk about your skincare going forward if you had a laser, and make sure we've answered all of your questions. Your second follow-up will be a week later, and at this visit, we'll remove any sutures in your scalp or staples behind your hairline. This is also a time that we recommend starting scar care, and biocorneum, which also has an SPF, is what started on those visible incisions, and you rub it in twice a day. If your eyes are still not closing all the way, we can also give you some silicone strips that will help hold your eyes closed at night. It's hard to know how quickly people can be driving after surgery, but definitely not less than 1 week and probably closer to 2 weeks. You absolutely cannot drive until you're off your narcotics and Valium. Head turning is discouraged after a facelift, so not being able to look over your shoulder makes driving far less safe. Your vision needs to be clear, and you just need to use good judgment about when you're ready to drive. Also remember that your reaction time is likely going to be slower than normal, so if traffic conditions are poor, just let somebody give you a ride. More long-term follow-up is really on an as-needed basis. Some people have little areas of their incision that haven't healed well, or we may be following recovery of muscle weakness that can take several months, and swelling takes at least 6 months to resolve. Many patients are eager to add some more volume with injectables once this swelling has gone down, so this may be okay anywhere from about 3 to 6 months after surgery. Congratulations, you're now prepared for your facelift surgery. Make sure you bring a list of questions to your pre-op. Please share this video with your caregivers. Be sure you've allotted enough time to heal. You can heal with things on your body or your breast that can easily be covered with clothes, but you don't want to be stressed out that you're going back to work too early and uncomfortable with your appearance. And most of all, follow your instructions so that you can heal as quickly as possible without complications.